Well, in the budget last week, money was set aside for the National Health Department to help deal with mental illnesses. But compared to the amount of money set aside for physical illnesses, it's really a tiny amount. Now, think about the incidence of mental health, how it's increasing, how many people are still dealing with the difficulties and often depression from the pandemic and carrying the burden of that time. The SA Society of Psychiatrists is warning that government should be spending more resources in trying to help people before mental illnesses become more serious. Dr. Alicia Porter is at the SA Society of Psychiatrists. Dr. Porter, good afternoon to you. What are you worried about here?
Hi, good afternoon, Stephen. So we are worried about the allocation of the budget because only, approximately 5% of the health budget is actually spent on mental health. But it's not just that allocation per se, but it's also how that allocation is spent. In South Africa, we are very hospice-centric, health system. And so, of that 5%, the majority of that spending is actually on inpatient care and on severe mental health conditions, which only have a prevalence rate of about 1%. Whereas your common mental health conditions like anxiety and depression, which we've seen a significant increase since COVID, that is really underfunded because that's where, that funding would come from, primary care level rather than, hospital level budgets.
The thing is that if you help someone particularly suffering from anxiety, particularly suffering from maybe some depression, and frankly who didn't after the pandemic or during it, if you spend that money wisely, you can really help people. And I mean, just from a financial point of view, you can save yourself a lot of money because the situation won't get any worse. You can do an intervention early.
100%. And also, depression is one of the leading causes of disability. And so the depression, which can quite easily be, treated, if it is treated early and treated early, treatment is, it's not necessarily chronic treatment. That could actually then assist the person to actually then return their functioning, and they could then continue to function, whereas untreated depression can then lead to complications. It leads to a loss of functioning and ultimately unemployment, and it then, contributes even to the overall contribution and the GDP of the country. So it's about how we spend what we have, not just kind of the fact that we have little, but even how we spend that little that we have.
Normally when someone has a physical problem, they go to a clinic. So if they've got headaches, whatever it is, they go to a local clinic. Are local clinics at all, government local clinics, equipped to help people with mental health issues? I
mean, there are some psychiatric clinics at community level, but there certainly isn't enough. And the mental health clinics are not treated, as equal to the physical health clinics. It almost feels like it needs to be a separate entity or a standalone, whereas maybe if mental health was treated as part of, the physical health complaint rather than as something completely separate, we may also then have more resources at community level. And that's really where the difficulty comes in, is the lack of mental health resources at community level.
So, the question, of course, is also, people themselves don't know that they need help. This is one of the great problems of sort of being a human being, is you don't always know when you need help. It's easy if you break your arm sore, you go to a clinic, that's easy. It's when you're suffering from something like this, you don't know. So often it's people around you who might notice, or maybe, if you're lucky, you go walk past the clinic and someone there sort of spots some signs. How much better do we need to get at helping people seeing the symptoms early, dealing with the symptoms earlier?
I definitely think that we need to increase awareness with regards to mental health concerns. I'm always sort of shocked at how, clients are often really shocked when you say, you are suffering with depression or anxiety. And yet it's really clear to you, but it's not often clear, especially in the way in which some, particularly anxiety and depression, may present. And there's differences between males and females. there are cultural differences. So I definitely think it's about creating more of an awareness, and and I think that would go a long way in terms of people being able to pick up, like, for example, when they have diabetes or hypertension. I think we should really aim at creating more awareness so there can be screening and also early detection. And maybe that's what needs to be incorporated into community care, even at physical clinics, that we start screening for mental health concerns, for things like depression and anxiety. The severe mental health conditions are quite obvious, because they present quite obviously, but it's the common mental health care problems that are then, they often go undetected.
Dr. Porter, how does someone know if maybe they need to go and get some help themselves? I mean, what would be the sign that would tell someone, actually, I need to go and get help and I need to do that now?
So, I mean, if we're looking at depression and anxiety, if you have difficulty or you're not functioning the way you used to function, that's usually quite a red flag. But also just things like sleeping, like your sleeping patterns, your eating patterns, your energy levels, even just identifying or being able to identify your level of stress and the impact that is having on you is often a telltale sign where you're just not feeling quite like yourself. Or, in the case of anxiety, you may have lots of physical complaints. Oftentimes people end up in emergency thinking they have a heart attack, or they're having a heart attack, or they have some, chest problem, and investigations then show it's actually just stress. So it's really just about being more in tune with what's happening within our bodies and noticing even those changes. And if you're not performing the way you used to, then maybe it's time to stop and kind of say, okay, is there something more going on? Because a lot of the time these patients also, even within the health system, they are investigated to a standstill when actually the problem may have been a mental health condition, but nobody's then screened for this problem. And so we've spent, again, lots of money on sometimes tests that may have been sort of prevented if we had maybe done some screening with regards to just the common mental health problems like anxiety and depression.
Dr. Alicia Porter, thank you, at the SA Society of Psychiatrists. Really appreciate the time.